Good evening. I'm Sister Catherine Ryan. I'm privileged to serve as the Executive Director of Maryville Academy. I am delighted to be here this evening for this program, Children First, which is provided through CAN TV and Maryville Academy. Tonight, our guest is Dr. Joseph Novak. I'm excited to introduce Dr. Novak, whom we have been able to persuade to be the CEO of our Hospital for Children. But more about that later. So, Dr. Novak, first of all, can you tell us a little bit about yourself? How in the world did you get into this field of healthcare?
Oh, good question. Got to go back a bit. It's been about almost 30 years since I've been in the field. I think it started off for me when I was in Lake Forest College and actually did a short internship over up in Waukegan at the juvenile probation and was just fascinated by what was happening to the kids up in Waukegan at the time. This is going back about 30 years. And many of the kids that were detained were really kids who also had mental illnesses, but unfortunately were in the juvenile system. Mm-hmm. And I would follow around the juvenile probation officer and just learned a lot about these kids and the struggles that they had, and that led to my pursuing this career.
And you, in your academic training, you are a psychologist?
Correct. And what that means is I have my doctorate in psychology. Actually, it's a PSYD, doctorate in psychology. I received my doctorate from the Illinois School of Professional Psychology many years ago. They're referred to as Argosy University now. Received my master's from the University of Chicago and my undergraduate at Lake Forest College.
It's a great start for the career, and then from there you went to work where?
From then, part of what you do when you are training to become a psychologist, you have to do an internship. And my internship, I spent 12 months at Chicago Read, which is a mental health facility in the city. And in those days, there also was what was called Henry Horner Center. And Henry Horner Center was inpatient mental health services for children and teenagers that was run by the state. And kids spent many months there, and I spent 12 months there actually learning and getting my internship completed. And it was fascinating again because in those days kids spent months psychiatrically hospitalized. And I got to know them over the course of 12 months through my work with them through treatment and also escorting them in those days out of the unit across the quite a distance to the gymnasium and to school, and was able to actually, through those 12 months, work with 2 or 3 adolescents throughout the course of the 12 months and learned a lot about them and also learned a lot about the career. When I was all done with my internship, part of my internship, I was doing outpatient work in Arlington Heights. In those days, it was called Northwest Mental Health Center. And when I finished my internship and received my doctorate, Northwest Mental Health Center asked me to stay on as a clinician, as a therapist. And that started my career. I spent 5 years at Northwest Mental Health Center, first starting off working with children and teenagers, outpatient, doing therapy. Did some also additional training in working with developmentally disabled, and work with the developmentally disabled children and teenagers, and subsequently became the clinical director at Northwest Mental Health Center. And it was a great experience because it gave me the perspective of what's happening in terms of mental health services in the community, and where most of treatment really does happen, which is in the community, and where even when a child is hospitalized, they come back to the community, and that treatment is so necessary to keep the kid on the road to recovery.
Now, before we persuaded you to come to Maryville, you were at...
After my work at Northwest Mental Health Center, I was hired back in 1990, going way back, at Northwest Community Hospital. And at the time, Northwest Community Hospital had inpatient mental health services, but they wanted to open up an adolescent unit. Inpatient unit, and so I came on board to open up that unit. Started in January and opened the unit in April of that year, and created the program, hired the staff, and we put together a wonderful team And again, in those days, most of services was inpatient based, and over time we developed step-down services. For example, partial hospitalization, intensive outpatient, and what that means is that when a child or a teenager was hospitalized and then needed step-down services before they went back into community services, they would come back to us during the day and would go home, and that helped with their transition to recovery. I was at Northwest Community Hospital for 23 years, from opening up the adolescent psychiatric unit, to actually eventually becoming the director of services at Northwest Community Hospital, which included inpatient adult and inpatient adolescent and partial and intensive outpatient, which is those step-down program. And along the way, about 9 years ago, Northwest Community Hospital is a community-based hospital, and we recognized in the area of Arlington Heights the need for substance abuse treatment. Unfortunately, and to this day that's indeed true, many adolescents are struggling with substance abuse besides having a mental health issue. In fact, what's interesting is that when you take a look at adolescent teens who are hospitalized psychiatrically, probably, in my experience, 70% also had some type of substance, a drug problem. So we opened up a residential drug program for teenagers, and that included where they would stay with us up to 30 to 40 days, some a little less, some a little more. And then we would offer them other services such as a partial, where they would come during the day and go home to where they lived, and then also an evening program so they could continue their road to recovery. Because with adolescents with substance problems, we know that if a teenager stays in a drug program for at least 9 months, there's a 70% chance they'll stay sober. If they do not continue, they leave prematurely, it drops down to 30% in terms of relapse and in terms of risk of even death.
Well, I think our listeners now can hear why in 2013 Maryville asked you to come be the CEO of Maryville's Behavioral Health Hospital, which maybe our viewers haven't seen, so I'm just showing a quick view of that there. So, Dr. Novak, during all this time, you also maintained your private practice, didn't you?
Yes, I did. I still do.
So, is it fair to call you a practicing psychologist?
Yes, that would be a true statement. One of the things I decided early on in my career, it's interesting when you in our level of in treatment, working with children and teenagers and adults, most of us don't decide, oh, we're going to go right into management. It's something that evolves because you take a leadership role as you progress. But one of the things I wanted to make sure is that I stayed sharp with the treatment aspect of, and that means that I kept my outpatient practice, because I wanted to make sure that I was still working with teenagers and children and young adults and working with their families. So I maintained my perspective of what it's like for these kids to struggle and the traumas they would go through, so that as I worked in a hospital setting, I could still relate and still be able to mentor and support the staff who were providing the treatment, because I had that perspective as a clinician.
I'm sure that makes a big difference I have seen. As long as you really understand what our children are experiencing and what treatment is while you're in the management role. So now we have invited you to the Maryville Behavioral Health Hospital. I'm just going to show it one more time. And this hospital of ours is located in Des Plaines. And what our viewers may be surprised to know is that our hospital serves children from ages of 3 to 21. So I'm sure that viewers hearing that say, what, children as young as 3 or 4 or 5 in a hospital? And clearly we don't want children to be in the hospital, but tell us, if you would, first a little bit about the little ones, the pediatric unit, where we serve younger children when necessary.
Sure, thank you. Your point's well taken. Tragically, children as young as 3 at times need to be hospitalized psychiatrically because of, unfortunately, what they've gone through. Many of the children that we work with have gone through a series of trauma. trauma from perhaps not living in a home setting and have to go into foster care, be pulled out of their home because they have been victims of abuse or neglect. And so many of these kids, because of that experience, at times need the safety and the support and resources that we offer at our hospital. Also, some of these kids come from situations where even at the point of birth, there's been trauma because of the choices that a parent made, where there might be substances involved during the pregnancy, and there might be potentially violence. And that we now know more than ever. I can say this because being in the field for 30 years, I probably was naive early on in my career and have learned that lesson that we now know that trauma and those types of experiences really do deeply affect the children that we work with, and we have to really fully understand that to help them recover. And even one type of trauma, when you're talking about a 3 or 4-year-old, can have a devastating effect. And it's our job when these children are hospitalized to help to understand what they've experienced, to help start that road to recovery, and to help to work with that support system, be it parents, be it a foster parent, be it they live in a group home setting, how they can help this child so when the child leaves our hospital, that these kids can continue that road and to find where there's resilience on the part of that child so they can start to find some success in life and find that life isn't as horrible as they've experienced.
Dr. Novak, I think we have a caller. So let's just hear the caller's question.
Okay.
Yes, good evening, guys. And listening to the doctor speak and listening to his profile, I'd like to commend you and thank you for this work that you're doing. See, a lot of times people have a tendency of forgetting that they always just looking at the adults with substance abuse or mental problem. People have a tendency of forgetting there are small children and teenagers that has problems. And if you catch them and resolve these early, they become productive citizens, productive adults, and that means sometimes you might find those productive people is our future. See, we can't just say, forget it. So again, I want to commend you, doctor. I hope you continue to keep doing what you're doing. I hope there's other doctors see what you're doing, and maybe they want to take on with some of the things that you do. So listen, I want to thank you so much. Keep on doing a good job, and wish you all the luck. And this is all I did. Just want to commend you. Thank you for taking the call. Let me get out there so I can hear your comment, and thank you.
Well, thank you. And your perspective is actually a very good one because it really does support why we exist. And that is we know when children are vulnerable and they've been injured emotionally, physically, psychologically, working with them early on helps hopefully to start the road to recovery. When a child has been a victim and doesn't get the early help, mm-hmm. and the risks continue, and now this child is now 21 or 25, think about all those instances and all that time where this child has tried to cope the best he or her can, and now is 21 or 25 and didn't receive that help and doesn't have those tools to be able to successfully manage life. And life we know is difficult, but think about somebody, a child, who come from circumstances not by choice, because children don't have those choices. They're born into this world, but they're born into some circumstances where there's been trauma, where there's been injury, and perhaps there isn't a person, or perhaps there is a family trying to do the best they can to help that child recover, but not gaining the access to those resources so that a professional can work with that child to help them understand, hey, this is what you've gone through. You know what? We can help you through this. and in time give you the tools that you can use to successfully manage so that you can become a productive adult. Because isn't that what we strive for with our own children, to help them, to mentor them, to support them so they can become successful adults? So your comment is wonderful, and I appreciate it, and it really does echo why we exist as a hospital, because our job is, just as Sister was talking about, we treat ages 3 to 20. It's the vulnerable children that we have a responsibility to help. I tell the staff it's all about the kids. That's why we exist. That's why this hospital is there, because there are children that we work with that perhaps other systems may choose to work with, but we make that decision, say we treat all children who need hospitalization in a psychiatric center like ours, where we can provide a safe environment, but also to start teaching them alternatives so they can recover. And as I said earlier, it is about giving kids tools. I so often talk to the kids about toolboxes and give the reference to the carpenter. A carpenter comes to work with a toolbox, but he or she chooses the right tools to be able to perform what they need to do to craft, whether they're building a house or they're creating a wonderful piece of furniture. In life, it's the same metaphor, that you need the right tools to craft that pathway to be successful. Without those tools, you're left with limited resources, and unfortunately you use what you think you've learned, and those things you've learned may not help you be successful. So thank you.
Perhaps the listeners would like to know about our doctors who serve at the hospital and some of the cultural backgrounds that they bring particular interest with.
Oh, good question. In a hospital like ours, our physicians and our nursing staff as a team is what makes a difference and help these children. And our psychiatrists are all board certified in child and adolescent psychiatry, which means that they all go through medical school and they go on for residency, and then they take a series of examinations so they specialize in this population. Now you may think, why is that important? Well, think about where a 3-year-old is at developmentally in terms of where they're at with their brain maturity, with their physical growth, and think about where a 10-year-old is at and where their 17-year-old is at. Our doctors have that background and have that training and experience and knowledge to be able to truly do that evaluation based on how old that child is and what that child needs, and if that child needs medication, that they can best serve that child because they have that expertise. And that psychiatrist really is the person who's at the helm with the treatment team, not only evaluating the child's need, but working with our team of social workers, our team of psychologists, our team of therapists, our team of substance abuse counselors, and so on, to best create a treatment plan for that child, and that's where our psychiatrist is so important. Sister was talking about the backgrounds of our doctors. Our hospital does treat a diverse population, and we know that our population in our area of Des Plaines is a Latino population, and I'm proud to say that some of our doctors speak Spanish, for example. One of our doctors actually speaks Polish. He is actually from Poland. And that is important with the kids we serve, because it's the family, the parents, and those adults who are with the children that may not be able to speak English as a first language, and we want to be able to relate and connect. And it isn't just the translation of the words; it's the understanding of the cultures, right. Which is so essential, because certainly we can interpret the words or translate the words, but to understand personally what culture a child comes through, and not imparting our culture, my culture, on that child, but understanding where this child's coming from and the family's coming from, and being able to recognize this child's going back to their culture. I don't have a right to make that decision of what I believe is right or wrong. I have an important understand their culture, and help that child navigate and that parent navigate. So I'm very proud to say our doctors with their background are able to do that, and understand the children that come to us, because our children come to us. Maryville Behavioral Health Hospital is located in Des Plaines. But what you'll discover is that we treat kids from miles and miles away, from a broad area, because the children we treat have special needs, have special challenges and trauma, and we don't turn them away. So they do travel a distance, and we try to help parents who have to come visit because sometimes the miles are long. So we make good use of their time when they come to us, so that when their child leaves, goes back to the home or back to the place that they were living at, that we have been able to give the right care and also work with the families.
In fact, there's another way we can stay in touch with our young folks when they're patients with telepsychiatry. Could you tell our viewers what that is?
Absolutely. The good news in the state of Illinois is telepsychiatry, telemedicine is recognized, and what that means is that we set up a video connection from our hospital also to another facility, so that those family members who can't come here, and in fact we're working in that right now with a few of the outpatient programs that we work with, and also at a distance, so that the families can video connect live on a video screen with the doctor, or with the social worker, with the psychologist, as opposed to having to travel sometimes as much as 2 or 3 hours to us. And that isn't always practical for the families we work with for a variety of reasons. Transportation, actually, curious enough, transportation is probably one of the biggest barriers for getting treatment, outpatient or even coming to a hospital. We may think that people have transportation, but when you take a look at people living in the suburbs, there isn't a bus to us, there isn't a train to us. You have to have a car, and many people don't have a car or don't have a car readily accessible. So telemedicine, telepsychiatry allows that gap to be bridged, so that they can be on one end at one facility, and our doctor can be another end, and they can connect. And you may think, why is that important? Because isn't a phone call important? Well, you know, it's interesting. We're connecting right now, and as you're paying attention to this, and isn't it powerful to see us visually and also to hear our voices as opposed to just hearing our voices over the phone? You don't pick up the body language, you don't pick up the gestures, the concerns, and we want to be able to connect and see that when a parent's on the other end of the video connection, how upset they are, and their voice doesn't always give us that, but certainly how they look and what they're showing with their gestures or their face tells us a lot. The other important thing about telemedicine is that setting it up in an outpatient setting where a kid's going to go back to, that means that outpatient person, that outpatient counselor, can also connect with us, because they would have an issue traveling a couple hours to us as well. So it does connect to the divide, so to speak, and we're able to use technology in such a wonderful way where without the technology, a parent or even a professional may not be able to come to us that often. And with inpatient psychiatric care, the kids are with us about 14 to 16 days, some less. And so we have a short period of time to get that kid stable and get that kid back out to the community. And that family member or that professional from the outpatient setting may not be able to come to us that often, but certainly telemedicine bridges that gap.
And we know that the children are very comfortable with
Oh,
all
absolutely.
these computers
Absolutely.
and screens, so they have no problem talking to the doctor.
Absolutely.
But our viewers also probably want to know that this is a secure communication. There are special provisions with this equipment so that everything that's said stays between
Yes.
the doctor and the family, the child or the
Absolutely.
parents.
Yeah, it's an excellent piece of technology, but you're absolutely right, sister. It's not where it's broadcast, where it's available to anyone else. That's why with telemedicine there are certain standards and provisions that are set up. But once those are set up, there's a nice link.
So, Dr. Novak, can you tell us about the children in the hospital? What are the age groups? Are they on different units? We have boys or girls. Would you tell us?
Absolutely. As we were talking earlier, we have a children's unit which is ages 3 to 11. And that is a unit where the children are by themselves, and there's no other age group there, and that's for their safety and the fact that they're young children and they need to be taken care of. And the staff that are dedicated to that unit are working with that population. Then we have an adolescent girls unit, and that is ages 12 to age 17, and an adolescent boys unit, and they're separate units. So the boys are in their own unit, the girls are in their own unit, and then we have a young adult female unit, and that's for ages 18 to age 20. When they turn 21, they're really our program is not the right program for them because of their age. And so all those units are unique. We don't have the adolescent boys and girls mix. We don't have the adolescents going to the children's unit. We don't have the young adults going into the adolescent or the children's unit. And each unit is specialized to work with that particular age group.
I think that it would be good to give you the phone number right now, just in case someone wants to reach Dr. Novak at the Behavioral Health Hospital. So here's our phone number, 847-768-5674. And so now we'd like to thank all of our viewers for being with us tonight. And Dr. Novak, we want to thank you
Well, thank
for
you.
telling us about the needs of our children and ways that we can help them.
Well, thank you. And as I want to end, it's what we say every day. It is all about the kids.